Hey everyone, Dr. Alex here. I've got a quick video today inspired by a patient encountered yesterday and something that I see quite often in the office, so I thought I'd make a video to help everyone. So a complaint I get a lot in the office is people getting back pain when they're bent over doing the dishes for long periods of time, or when they're they're vacuuming, or they are using the broom to brush the floor, or this would be the same type of back pain that people often get with shoveling. And so a really quick fix for this is, it may not necessarily be a strength issue. It may not necessarily be a problem with the spine. It could just be a movement problem where somebody is bending too much with their low back as opposed to bending over with their hips. And so the difference with this is using the low back to flex forward versus using the hips to flex forward. So what you're going to do to practice this, pardon the changing light, what you're going to do to practice this is you're going to practice a hip hinge. So the hip hinge is where we have a point on our broom or a golf stick or our hockey stick. Head, mid back, and low back are always touching as we stick our butt out and hinge forward at the hips. If you bend with your back, you'll notice you'll lose that point of contact in the low back there. But if you bend in the hips, all 3 points will remain in contact, so that when you are doing the dishes or vacuuming, all of the load is going to be on the glutes and the stronger hip muscles and not on the smaller low back muscles. Now, if you try this, for most people, this is going to make a big difference. So I would practice a few times with the broomstick, pushing your butt backwards while keeping the spine totally straight. Use your broomstick, and that will help a lot of people. Now, if it doesn't, there could be some sort of underlying problem with the spine, or there could just be a weakness in the low back. That's where you're going to want to see a professional to have that assessed. But this quick tip is going to probably help a lot of people out there. So I encourage you to try it. And the other thing that you could do is with that hip hinge, if you're still getting some discomfort, try putting a hand, but typically you're going to need both hands to do that work. So thank you guys for watching. I hope that is helpful. There is a video below that will give you a little bit more information and detail on how to do that hip hinge in our corrective exercise video. I'm signing off. It's dinner time.